So we're going to be coming up to the leg line area. So energy lines of the leg. We're not necessarily going to need to use their names. We're going to say inside 1, inside 2, inside 3, same thing outside 1, 2, and 3. And I'm going to show you the segments here. It's best to know that we are using energy lines to begin our practice, and the fact that they become, we're using segments now, and the fact that they become lines and they do have names and they have a great healing system connected to them, energetic system connected to them, and how they interrelate with our yoga poses and our symptoms and stressors. But for today, simple. So we're going to be addressing them in an A, B, C, B, A pattern, which is a stretch. We're going to palm the area. We're going to thumb press our energy lines together. And then after we do that, we address the lines, then we palm it out, and then we'll give it a little stretch to say goodbye. And then we do that same repetitive thing on the next section, A, B, C, B, A. So remember that. Stretch, palm press, energy lines, palm press, stretch. It's a system and a way of massaging people that no matter what section of the body you're on, you have that as a go-to. It's a form of massage. You stretch it, see what's going on, palm it out, you get a little more information, address the energy lines, see what's congested or left in there, and then okay, you palm it out and you stretch. And that's information for later for the bigger stretches and things that we'll come to. So energy lines, we're going to be working with 2 on the inside and 3 on the outside. So for your reference, they are in the book and you can check it out, page number 68. It's not the best for the inside lines, that's why I'm going to show you, and 670 for the outside. So inside the leg, we are going to be looking at, there's my fancy leg. The front of the malleolus is where we're working, and you're going to drop, like dive into, you're going to follow this line, diving into the gastrocnemius edge, so you feel the bone turn into the softness of the tissue, and you're slowly working that away until you come up into the little corner of your knee. So it's the medial edge there of the patella that comes up to the upper corner of the patella here. And there's a muscle here from your patella straight into your hip. It's called a rectus femoris. And actually, we're going to have an energy line on the inside and outside of our hip bone, inside and outside one, that goes right over the knee. So these are going to mirror each other, okay? Inside, outside one. So inside one comes from the inside of the patella straight up towards that hip bone, but we don't go up to the hip bone. We're going to conserve and reserve our femoral artery plexus area, femoral triangle, being conservative. As new practitioners might be getting into the practice, we definitely don't want to get close to the pelvis and the genitals. We want to conserve that space. Staying down into the bulk of the tissue, to the bulk of the adductor muscles is fine. When you get the hand in there, it's usually enough, especially for first timers. So we're coming and making our way up into the bulk of that tissue, and then we make our way back down. And I say all that preparatory stuff about the pelvis and the genitals because line number 2 comes behind the malleolus. It's going to be your inseam of your pants. So if you have a good pair of yoga pants, that you can line it up and you can cut that gastrocnemius belly. It's a lateral posterior, medial posterior edge of the leg that comes right to the side of the knee and right through the side of the adductors and goes straight up towards the pelvis, like where they attach. So again, here you want to like visualize a hand length away and stop in the bulk of the tissue when you're making your way up here, and palm presses and your fingers. Okay, so ethical rules, give people space. So we'll bring that back out. So that's inside 1 and 2 that I'm going to be working on here. And then there's 3 lines for the outside. So hopefully you've been checking these out and feeling them out on yourself. If not, please join me. So the outside line number 1 is in front of that fossa, and the tibia, and you'll feel the tibialis anterior. Again, you're slowly diving away from the tibia into that muscle, tibialis anterior, like I said, to the corner of the patella, gently making your way up. This is, again, lining the rectus femoris, making its way to the outside of the hip bone. So a lot of times I look visually, kind of draw myself a line and go back down and then trace that. Now I also come up and touch the hip. I'll show you so I know where that hip is and come back down. Now, as far as the outer 3 lines go, we can actually come up towards that hip bone and get into the glutes. It's less intimidating to our clients to go this high, and it feels really good. If you really don't know somebody, you might want to ask them if you can reach this high. So number 2 is technically your outseam, right? Cuts the leg in half. So you kind of start on the malleolus, working your way up the fibula, getting the muscles soft. You'll notice they're probably pretty tight. You come right through the side of the knee and then up into the IT band. And that goes up to the femur, head of the femur, and then you'll find some, like the attachment points of gluteus medius and minimus. And we'll go right back down. So number 3, lateral posterior edge of the leg. It's actually what's laying down on the ground in Savasana. So from here, it is kind of near the soft of the Achilles. You'll feel the edge of the gastrocnemius, and then you'll feel like the hamstrings. You can see it's not behind my knee, it's like on the side. So the side lateral posterior edge comes up to the glutes. I have to squat a little bit so you can still see it. And you'll know, I usually say those are the money spots. They feel good. And then you come back down. So for now, we work on the 2 inside and the 3 outside. For your reference, later there will be the inside 3rd line that comes from the sit bone all the way down to the Achilles. So we'll talk about that later as it comes in later in the massage.